Hello, everyone. We are live now, and we welcome all our attendees and great panelists for this amazing workshop.
So hello, good morning, everyone. It's my pleasure to welcome you to today's webinar hosted by the European Alliance for Value and Health. My name is Hans Baks. I'm Senior Advisor Market Access at MedTech Europe, and together with Michele, one of the two co-chairs of this alliance. And I'm really delighted to open today's session, which will bring together colleagues and partners from across Europe. Some of you already have been involved with the Alliance, and for others, you may be joining us for the first time, but you're all very, very welcome. So the title of today's session, A Compass for Collaboration, is both timely and intentional. In a time of growing complexity in healthcare, what we all need is a common direction and a shared sense of purpose. And this session today is about discussing the hard questions. Why do health systems need to change? What is the sense of urgency? And how can we all work together to make value-based health systems really happen? Next slide, please. So today we've got a very rich and interactive agenda lined up. And in the next 90 minutes, and we really have to be strict on time, so we have a hard stop after 90 minutes. Michele, Director of EUREGA, will present our recent report, A Compass for Collaboration. Then Martin Uriarte, representing DG RTD, will provide the EC perspective on value in health. And then Casper Paardekoper, partner of Ventura, will take over, and he will host a panel discussion featuring various representatives from health authorities, academia, industry, and patient organizations. And our goal today really is to learn from each other, and to push forward and to better understand how we can push forward the conversation on how to truly implement value-based health systems across Europe. And we are looking also for your input. So please make use of the Q&A later in the webinar, as we are really looking forward to also hearing your perspectives and your view on this really important matter. Next slide, please. So today, a warm welcome to Michele, to Alex, to Antonella, to Hamish, and to Thomas. But most important also to Martin, who apparently is not on this slide, but you are really our special dedicated guest. So all very welcome, and thank you so much for finding time to join our webinar today. Next slide, please. So before we start, a few words on our European Alliance for Value in Health. Next slide. For those of you who are new to our Alliance, we are a coalition of 19 European associations representing a wide range of stakeholders from across Europe and from across the health ecosystem. And these include patient organizations, health authorities, payers, providers, researchers, and the medtech and pharmaceutical industry. And we were founded on the shared belief that health systems in Europe need a fundamental shift. A shift away from volume-based care towards value-based, sustainable, and patient-centered healthcare systems. And we come together, we discuss, and we try to build bridges between all these different actors in the health ecosystem. Next slide. And our vision is ambitious, but also really necessary. A Europe where health systems deliver true value, and not just for patients, but for all European citizens and society as a whole. And linked to that vision is our mission, is that to make this transformation happen, we need to partner and we need to build bridges across stakeholders. And so we do this by sharing knowledge, by promoting best practices, engaging with policymakers at a European, national, and regional level. And because no one can do this alone, transformation as such really is a team sport. Next slide. So what does a value-based, people-centered system actually look like? And for that, we have defined 6 key principles that underpin our vision. And I will not run into them all, but these principles are meant to serve as a compass for everyone working towards the transformation. And for sure, Michele in the report will go into more detail, but you will also be able to find them on our website for more detailed information. Slide. So in addition to developing framework, writing these compass reports, and organizing meetings, we also focus on amplifying knowledge. And our website hosts a growing library of literature, case studies, blogs, and publications. And I'm really proud to say that as of March, so this month, we already gathered over 80 external publications, 15 case studies, and a growing engagement through our social media channels, in particular LinkedIn, where we have over 4,000 people following the updates on the work we do within the Alliance. And then my final slide. So with this short introduction to who we are and what we stand for, I'm excited to now hand over to Michele Calabro, Director of EUREGA, which is my valued co-chair of the Alliance, to dive into our latest publication, A Compass for Collaboration. Michele, sorry, the floor is yours.
Thanks a lot, Hans, for the kind introduction. Indeed, I'm also happy to welcome. I think we over 40 participants already to this webinar, which is fantastic, and I see some familiar names and some new ones. So really great to welcome you also from my side. I'm Michele Calabro, the director of EUREGA. We are a network of regional and local health authorities from across Europe, and of course, we've been involved in the European Alliance for Value in Health for quite some years now already. But what I'm going to talk about today, it's indeed our most recent work with the Alliance, the Compass for Collaboration indeed. So if we can go to the next slide. How we got to the Compass for Collaboration. We know, of course, that value-based healthcare is something that's been worked on already, but it's fairly limited to localized initiatives in Europe at this stage. So we wanted to work on how to overcome barriers to facilitate widespread implementation, and to do so, we actually had some steps within the Alliance, which are our main publications so far. So the first element was trying to understand how to talk to each other in terms of the topic of value-based healthcare. And that's why in December 2022, if I'm not mistaken, we worked on a token value, a taxonomy on value-based healthcare. Let's say we define our common language with that. From that point, we understood, okay, we're trying to start talking with the same language. We moved to discuss on the different roles of responsibility from the different stakeholders side. So we started our journey into the Compass for Collaboration, indeed, to navigate stakeholders' roles in transition into value-based healthcare. And we did this, of course, in collaboration with all a series of stakeholders from the healthcare community. And I will get to that in a second, while also in the chat, you can find the links to these publication. If we can go to the next slide, the report itself indeed was developed through a very multi-stakeholder initiative across 2023-2024, which is, very much the essence of what the Alliance is. And indeed was looking at clarifying roles and contribution that can be taken by stakeholders to accelerate the journey towards developing value-based health systems. We looked at it to try to identify at least a first starting groups, 8 groups in particular of stakeholders across the healthcare ecosystem that play different roles in the transition: patient and patient advisory groups, government agencies of regulators, healthcare managers and procurers, healthcare professionals, payers and insurers, HTA bodies, industry, and value-based healthcare enablers, such as, for instance, knowledge brokers, universities, and so on. The development was done together with representative of these stakeholders. It started, of course, with a literature review, an expert survey, and then culminated in a multi-stakeholder workshop, which was attended by 30+ experts across these defined stakeholder categories, really to understand each stakeholder what can expect also from the other categories. So if we can go to the next slide, where I'm going to give a little bit more of an indication. So what you will find in the report, essentially, it's a bit more details of actions to support the transition to value-based healthcare identified across these groups. I will get to like some examples, stakeholder category per stakeholder category in a second, but clearly the general idea was to bring together collaboration to achieve value-based healthcare. And in general, 4 key themes emerge when considering goal actions. The need for measurement of patient-relevant outcomes measured, linking payment to value and outcomes rather than the traditional fee-for-service approach, ensuring integration across the full cycle of care, and the importance of keeping the patient at the center in the transition to value-based healthcare. These are really like 4 major macro themes that emerge, but in the report, you will find a breakdown per each stakeholder category. And if you can get to the next slide. I will just highlight here some of the keywords that stay that we find for each group. For instance, for patient advocacy groups and patients, we looked, of course, on the active involvement and informed decision making in disease management and treatment processes for patients. With patient advocacy groups, elements such as co-creating the definition of value-based and advocating for the use of patient-relevant outcomes measure, support training and education in the patient community, and so on. In terms of government agencies and regulators, some of the prioritized list of actions we looked at defining policies and models to promote patient-centered integrated care delivery, incentivize efficiency by breaking down budget silos, allocating resources towards high-value care and prevention, transparency for decision-making, and also driving policies focused on outcomes-based payment models. Healthcare managers and procurers, we looked, of course, at actions such as increased engagement with patients to understand what value means to them. This is, we've seen, one of the most important, and done in a continuous feedback process, collaboration with healthcare professionals as well to redesign pathway of care to integrate the model, looking at allocation of resources towards value care, high value care and prevention, and ensure integration across services and across the full cycle of care. So indeed, you see recurring themes, integration, engagement of patients, and of course, investing resources and efforts from all the different stakeholders into making the transition happen. Next slide. In terms of healthcare professionals, again, a matter of collaboration with and empowering of patients to joint decision-making, education, and encouraging patients to share their outcomes data to a trusted route, driving continuous improvement by comparing outcomes, and of course, also seeking themselves an engagement in education opportunity on value-based healthcare. Payers and insurers, we looked at actions such as the promotion and implementation of use of value-based models such as outcomes-based agreement, creation of incentives to encourage providers to adopt systems that foster coordinated and efficient care, further investment in integrated care delivery, implementation of data sharing to guide better healthcare practices. With HTA bodies, we looked at topics such as including patient-relevant outcomes, patient preferences in value assessment framework, so with a more societal perspective, embracing and driving outcome-based agreement, and minimizing efficiency. So try really to get the best out of the investment in health. And of course, again, collaboration with patient expert. Finally, in the last slide, we also had industry as one of the stakeholder category with, again, payment and reimbursement models based on value for medical technology delivers to patient and society in collaboration with patient and providers. So very much a matter of collaboration. Collaboration also with public and private stakeholders to understand the unmet needs of patients, generate evidence on the health economic impact on medical technologies and impact on patient outcomes, and also developing interventions significantly improve such patient-relevant outcome and reduce cost of care. Finally, in terms of enablers, as I mentioned, could be, for instance, university, indeed having new and improved research programs to further support the evolution, implementation, evaluation of value-based healthcare, and deliver such educational programs targeting actually all stakeholders to support the pathways towards value-based healthcare. So this is in a nutshell really what you can find in the report. So I hope was also a little bit of a snapshot into what you can find in there. And again, it's something that we very much delivered and discussed together with different stakeholders, and of course it's part, let's say, of a journey. So that was me, and actually as part of the journey, I'm very happy to kind of ask the colleagues to go to the next slide that introduce indeed our guest speaker, Martin Uriarte. Martin is policy officer at the Health Innovation Ecosystem Unit within the Director General for Research and Innovation of the European Commission. As we're discussing value today, and we know how important in the recent publication from the European Commission, and in particular the expert group on health system performance assessment came out in February 2025. We wanted indeed to feature a European Commission perspective on value in health. So Martin, thanks again for being with us, and I'll leave you the floor and the virtual command of the slides.
Good morning, everyone. So thank you very much, Michele, for the kind introduction. And thank you to Euriga and the European Alliance for Value and Health for inviting us today to be here with you. So in my brief introduction today, I would like to first give you a bit of a view on the policy context that is most relevant to this topic of low value care that I will be discussing today. And I would like to highlight the potential of value-based approaches, and in particular of value care, of low value care reduction to make healthcare systems more competitive, more sustainable, and fit for purpose. Next slide, please. Yeah, so to start with, as we said, I would like to kind of give a brief policy context to try to explain where value-based approaches to healthcare and low-value care fit within the current policy context and political guidelines. So, as some of you may know, the new European Commission identified a number of challenges for Europe in the coming years. And based on those strategic challenges ahead, the Commission drafted a list of 7 priority topics for Europe in the years 2024-2029. So here in this page, you have priorities around things like defense and security, protecting our democracies, supporting people, and strengthening our societies and social model, etc. But the priority that I want to kind of highlight and call your attention to is the one on the top left side of the slide that reads a new new plan for Europe's sustainable prosperity and competitiveness. So this priority is pretty much an effort to create a region for economic growth, enterprise, and innovation in Europe, and we would like to do that by ensuring competitiveness, prosperity, and fairness. Next slide, please. So, based on this priority, the Commission in January launched the so-called competitiveness compass. And I'm conscious that this is a bit confusing because you're also talking about a different compass, just by coincidence. But anyway, so the Commission launched this competitive compass initiative in January this year. And basically, the competitive compass is a strategic initiative based on recommendations from the Mario Draghi report. That is based around a number of key actions needed to enhance Europe's competitiveness. The compass is built around 3 core areas of action. The first one is innovation. So this is pretty much around closing the innovation gap in Europe. Then there is a second area of action, which is around decarbonization and competitiveness. And this is about having a competitiveness-driven approach to the decarbonization of our economies. And thirdly, there is an area of action which is around security and resilience, so reducing Europe's dependencies and increasing resilience and security for critical sectors and technologies in Europe. So as you may see, there is a kind of renewed, strong emphasis on competitive and sustainability and sustainable competitiveness in our economies and in our societies. Next slide, please. So it is in this context that we believe that value-based approaches to healthcare can be very instrumental in enhancing the sustainability and competitiveness of the health sector in Europe. But before we go into that, I would like to kind of define or describe what we mean by low-value care, so we are all on the same page. So in this page, you can see a definition of low-value care by the European Commission's expert group on health systems performance assessment, the so-called HSPA. I will read the definition very quickly. So the definition says, low-value care encompasses overuse, misuse, and underuse of healthcare services. Overuse and or misuse comprise the delivery of harmful, ineffective, inappropriate, or not cost-effective healthcare services. Underuse refers to healthcare services not provided or used despite being necessary. Low-value care can lead to negative consequences for patients, their caregivers, the healthcare workforce, the health system as a whole, and the wider environment. So, as you can see, next slide, please. As you can see here, the HSPA experts group also published recently a report on low-value care. That is an excellent resource for policymakers, for healthcare providers, for any professionals working on health in general. And the report, apart from the definition of low-value care, also provides a framework of low-value care categories. So there are 9 different low-value care categories described in the report. There is a list of low-value care indicators linked to each of these categories. The report also contains strategies to reduce low-value care and country-specific examples and final conclusions and recommendations. So I would encourage you to have a look at the report and read it, especially if you're dealing with questions around healthcare efficiency and value. Next page, please. So now that we have kind of define what we need by low-value care, and we're on the same page on that, I would like to discuss what the benefits of addressing low-value care are. So first, there is a benefit in terms of optimization of resources. So by preventing the waste of valuable healthcare resources, we can allow resources relocation towards higher value care activities, therefore improving quality of care. So there is a first optimization benefit. Secondly, there is a benefit in terms of strengthening healthcare systems because tackling low-value care enhances efficiency and optimizes healthcare delivery and outcomes. Thirdly, and this is not an insignificant benefit as well, low-value care can also contribute to environmental sustainability of healthcare sector. By reducing wasteful activities in the health sector, we can also lower the environmental footprint of the sector, which, as some of you may know, is not insignificant. So it is estimated 5% of CO2 emissions globally are caused by the health sector. So as you may see, tackling low-value care can help us contribute to making health systems more sustainable and competitive within this wider policy trends and context to try to strengthen Europe's sustainable competitiveness. Next page, please. So why do we think that tackling low value care is key, especially today? It's especially important today. So first of all, low value care activities are not uncommon. In fact, they are really common. An OECD report estimated that wasteful practices are widespread in healthcare, and up to 20% of healthcare spending could be redirected towards more effective uses. So it's not a small amount of the spending of healthcare that could be better used. But also in the current geopolitical context, and I'm sure that all of you are aware of this, there may be increasing competition for budgets and for funds at national level, and it may be more and more difficult and challenging to access additional funding for healthcare. So we strongly believe that by addressing low value care and by eliminating activities that are either unnecessary or by using activities that are currently underused but could increase the effectiveness of healthcare. By doing that, we can reduce the waste of valuable resources and make healthcare more efficient, more effective, and more competitive, while also sustaining and enhancing the quality of care of the healthcare systems in the future. So this is the message that we would like to kind of leave you with today. We would like to encourage you all to look into the potential of low value care reductions to achieve more competitive and sustainable healthcare systems. Thank you very much for your time.
Thank you, Martin, for giving this great introduction and overview of the report. I know you have to leave. There's only, before we move into the panel discussion, I wanted to ask you one quick question based on the report. And we didn't discuss this before, so I hope you will not be surprised. But thinking about the whole topic that we discussed with our Compass report and the role of stakeholders, would you see if there would be one stakeholder group that would be most in the lead to start addressing the low value care? Because it needs to start somewhere, and I think it's essential, but usually it helps if there's one group of people that puts the most effort in there. Is there one group to start with, you think?
Sorry.
Sorry.
No, sorry not to have a very exciting answer, but I think it's difficult to single out one group of stakeholders. So obviously policymakers need to keep the kind of the wheel kind of turning soon. But I don't think is necessarily the most important stakeholder here. So I think what we will need is coordination and kind of collaboration between policymakers, healthcare providers, healthcare professionals, citizens and patients. That's going to be also very critical, because they're going to see these changes in their healthcare provision. So I don't have an answer for you.
No, but I think it's a clear one.
We need everyone working together, and everyone actually convinced that this is really valuable for our societies.
Yeah, because I think, into your point, the benefits are there for every stakeholder almost. So it's a need. So there's no reason not to start working on this, I would almost say. So, okay, thanks a lot, Martin, and great that you could make the time to join us for this webinar.
Thank you very much.
Okay, cool. Yes, let's move towards a panel discussion where we have 4 partners out of the Alliance participating. It's only 4 in this, and yeah, ideally, if you look at the Compass Collaboration report, we should have had 8, because there were 8 stakeholder groups, but we thought 8 people would be a bit much for a panel discussion. So without any prioritization, we have at least 4 key stakeholders represented. In the panel, we will have Alexis Strader, who is Director of Policy and Research at the European Health Management Association. So really representing health managers and partly also procurers there. Antonella Cardona, CEO of Cancer Patients Europe, quite obvious, representing the patients, of course. Hamish Lang, he's Director of Value-Based Health in the Care Academy in Wales, but also Professor of Enhanced Innovation Engagement and Outcomes at Swansea University. And Hamish brings in, I think, multiple perspectives. It's the education element, it's also the work he does with the Welsh government, so he has a government perspective, but as a background, as a doctor, he also has an HCP perspective. And finally, in the panel, we have Thomas Elfin, who's Executive Director, Strategy and Health Systems at FPA, the European Federation for the Pharmaceutical Industry and Association and member associations, so representing the industry. I will be starting off the panel discussion with a number of questions to the group. However, please also feel free to use the Q&A button at the bottom of your screen to start raising questions yourself, which in the course of this discussion, I want to raise to the group as well. Maybe, I don't know, does everybody has this? Yeah, this is, I think, better indeed for the panel discussion. I maybe want to kick it off with a question also that also immediately introduces also the organizations a bit in the panel, but maybe Antonella, you can start like with the question that everybody will get, but it's, why is your organization part of the Alliance, and what drives you and your members also to contribute to move towards value-based healthcare? And I realize you're the newest member almost of the Alliance, so really happy again that Cancer Patients Europe joined us.
Thank you, and good morning, everyone. It is a pleasure for me to be here with you today and to speak on behalf of Cancer Patients Europe, which is a pan-European all-cancer type patient association. We have decided to join the European Alliance for Value in Health for several reasons. So first, the improved patient outcomes. So value-based healthcare focuses on delivering outcomes that matter most to patients, such as survival rates, quality of life, and symptom management. And by aligning treatment with patient needs and outcomes, cancer care can become more personalized and effective. Then cost efficiency. By shifting the focus of value rather than volume, value-based healthcare can help optimize the use of healthcare resources, reducing waste, and ensuring that patients receive the most appropriate and effective treatments. This is particularly important in cancer care, where treatments can be expensive. Then cancer comprehensive care coordination. So cancer treatment often requires collaboration between multiple specialists and healthcare providers, and value-based healthcare models emphasize a better coordination of care, ensuring that all aspects of a patient's treatment from diagnosis to aftercare are managed in a seamless and integrated manner. Then access to innovative treatments. A value-based approach encourages the adoption of innovative therapies that offer better outcomes. And by focusing on results rather than the number of treatments or procedures, cancer patients can gain access to the latest, most effective treatment options. Then focus on long-term health. So cancer care doesn't stop with treatment. Survivors face ongoing health challenges, including follow-up care and psychological support. And value-based healthcare frameworks ensure that patients receive the comprehensive long-term care they need to manage life after cancer treatment, improving their overall well-being. And patient-centered care. So value-based healthcare allows cancer patients to be at the center of their treatment decisions. So patient preferences and needs and values are considered, empowering them to make informed decisions about their care, which can lead to higher satisfaction and better adherence to treatment plans. Then also data-driven insights. So with value-based healthcare, data is often used to track outcomes, which can help in assessing the effectiveness of treatments and in defining areas for improvement. And this can lead to more evidence-based practices in cancer care, helping to refine treatments and improve outcomes for all patients. And finally, collaboration across Europe. So by joining this alliance, cancer patients can benefit from collaborative efforts between healthcare providers across Europe. And this can lead to a sharing of best practices, expertise, and resources, helping to raise the standard of care across Europe and ensuring that patients receive the best possible treatment. So in short, joining the European Alliance for Value in Health enables us to collaboratively focus more on better, more coordinated and more efficient care, leading to improved outcomes, reduce costs, and a greater focus on what matters most to the patients.
Thanks, Antonella. And I think where Hans in the beginning kind of said, like, you can read on the principles of the alliance on the website. I'm not going through them. I think you addressed them all, and I think there was a really clear match between Why Cancer Patients Europe. It's so aligned with what you just described. And maybe just for the back, as a context, Antonella is at an airport, so we're happy that she's joining, but there is some background noise. I see some people commenting on it, but we can't do anything about it. But on the positive side, again, we're very happy Antonella's here. But it's a great perspective from the patient side. And maybe Hamish, why did I think the academy joined? That's the formal member. So what was the main reason for you guys to join us?
Thank you, Casper, and good afternoon, everybody. So we're very, very proud to be affiliates of the EU Alliance. Just to set the context, the Value-Based Health and Care Academy in Swansea University offers education, research, and consultancy in translating the theory of value-based healthcare into practice. And our passion is to see value-based healthcare happening, not just people understanding about it. And we are set in a country, Wales, which is the only global innovator hub at a national level identified by the World Economic Forum for value-based healthcare or value in health. So we've been at this for some time, and we think that if we are going to see value-based healthcare being adopted across health systems, it is really important that everybody is sharing knowledge. This is still an evolving field. As I say, the theory is reasonably well established, but how you do it in practice is not. And there is a lot to learn. We think research ensures that the education that we deliver is as good as it could be, but it is also important to advance knowledge, and we do that by sharing. And so we see being part of the Alliance as a benefit to us, because it gives us a chance to hear from other people and to hear their own experiences and so on, but also for us to share the learning that we have and the research that we and colleagues across the world are doing. So we think it's really important when you've got something that's still quite novel and people are still grappling with some of the practicalities, that everybody shares as much as possible.
Thanks, Hamish. And I think there's also some questions already, and I think we will get back to it. But I think it's interesting what I hear that you say it's still quite novel, and I think we can come back to that later. I think there's a difference of opinion. I think we see it still not getting off the ground, although the concept might be there. But I think to your point, indeed, we're absolutely not there yet. So in that sense, I fully agree it's novel. But further on in discussion, I think let's take it a bit how we see we can move it from novel to become a reality. So thanks for now, Hamish. Alexis, from the health manager side, why did you guys? And you didn't really join, actually. You were already part of the founders. So you joined, but you were already there from the start. So there was a clear drive probably to collaborate with other associations on value-based healthcare.
Yes, absolutely. By the way, first, I just want to thank you for inviting me to join this very important panel. And indeed, Emma has been involved from the start. So happy to be here with you all today. And I think this topic is very timely. So why did EHMA join? Yes, well, because health managers are important stakeholders in the transition to value-based healthcare. I mean, you asked MEP Uriarte, which stakeholder group is the most important to address low-value care? And he said policymakers. I would say health managers, because I think they're, of course, I'm representing health managers, but I always think they have an important role to play. You know, and from a health management perspective, value-based healthcare, at least how I look at it, is a win-win for all, because you're getting, you're prioritizing patient outcomes, but you're also ensuring that resources are used efficiently to maximize health benefits. So, I mean, to me, it just makes sense. And particularly for our organization, you know, we're a membership organization, and we act as, or we try anyway, our aim is to act as an amplifier of best practices in the evolution of health management. And so being part of this group is a way to leverage the knowledge and expertise within our membership base. And because our members are health managers from across the European region, and they are critical to spreading this approach and advocating for value-based healthcare at national and local levels.
Thanks, Alexis. And I think I realize I think it's essential for everybody to realize that health managers is a dedicated separate group, maybe from hospital directors and hospital boards, because that's what a lot of people might think. And I also, when we started working on the alliance, was like, what's the difference? But I think health management is more, it's the linking pin to the more reality on the ground versus the more strategy at the top. I think this is really driving health changes in the hospitals, on the ground, and in health systems. So I think it's sometimes deserves a bit of explanation what health managers are, because so. But thanks, and indeed, great to have you guys on board. And also nice that you pick up on like, it's not only the policymakers, it's also us that should drive it on value care. Fully agree. I'm always happy when people take responsibility and not point to others. Thomas,
Me too.
maybe. Oh, sorry. Thanks, Alexis. Thomas, also, yeah, like the industry, because sometimes people feel also the industry, like, why are they in value-based healthcare, and why do they want to go there? Because it's something in the healthcare system. What does industry have to do with this? So, why did you guys join or actually initiate the alliance?
So yeah, thanks so much, Casper, and I think first of all, a fundamental reason, I think we heard other speakers talk to it already, that this is a way in which we can keep health systems focus on what matters to patients, but also keep them sustainable and focus on what works. And I think in the end, of course, the industry operates within the health systems. The health systems is the procurer of innovation from the industry. So it's of course in everyone's interest that health systems are sustainable. Also in the future, in this quite difficult moment we are in right now, and that Martin from the European Commission touched on this. I think from the perspective of the pharmaceutical industry, I mean, I think if I may, I think that we would consider that value, both in terms of value for patients, but also value for the broader society, has been part of the pharma business model from the start. That's what we are here to deliver. And of course, this starts already early in research and development to try to understand what's the unmet need of patients, where can new innovation help, and then the entire chain of setting up clinical trials, going through the regulatory approval, and then the health technology assessment that now also part of that is now done at an EU level, is about determining the value. How can new medicines improve outcomes for patients and thereby bring value for patients and society. But I think that and that's all well and good, but that's sort of the pharmaceutical value chain. And I think that for this to really work, the entire system needs to be value-based. and that it's important that all the actors in the health systems have the more or less the same understanding of what is value, what are we focusing on, what do we want to achieve. Because if a payer, let's say, have a different understanding of what is value, what do we want to pay for, that is different from that of patient groups or from that of the industry or other stakeholders, then there will be a mismatch, and the system will not deliver at sort of it max capacity. So and I think there are all kinds of stories of this all around the system. But you know, if you have you know, there've been, I mean, just to have a very simple example, and where you know maybe a pharmaceutical company has developed a product that turns what was previously an injectable, so a patient has to inject a treatment, and now that is in the form of a pill that you can swallow with your coffee in the morning. Obviously, you know, for patients, this is a big difference, and something that they would value. But there have been examples of sort of an HTA agency or a payer saying, well, we don't consider this added value because it is the clinical effectiveness is about the same. So for us, I don't know why we should focus on this or pay for it. And so here you can see a misalignment on what are the patient outcomes we're trying to achieve, what is value. And the more we can discuss this and get an aligned view, the better the signals will work all across the system. So I think that's a very important reason for coming together with all the stakeholders and discuss how do we want the health systems to work, and what's the role of different stakeholders. And I think that's really the key of the compass for collaboration that I'm sure we'll dive into more in a moment.
And is it then just because I think indeed to your point, the value is probably value for both health system and patient, but is it in your mind the patients that define the value in the end? Are best capable of defining what value matters to them? Yeah.
Well, yeah, I mean, you know, I think that, you know, value-based healthcare is in many ways patient-centered healthcare. You know, that's a way of you could say repackage that. So what are the outcomes that patients care about? Then, of course, value-based healthcare has a dimension of cost, which is, of course, you know, how do we keep the systems overall sustainable? And here I think that the really point of value-based healthcare is to look at this at entire patient pathways, where you can have sort of a more holistic and long-term view of both the outcomes and the cost. So instead of just focusing on every individual, you know, intervention or action, you look at the entire pathway, because thereby you can also create incentives for prevention, doing things early, because that will reduce the cost in the long run, compared to not doing those things in time.
Yeah. And Antonella, I see you move to hopefully a little bit more quiet place. I hope that worked. And just to build on this, is that also how you see it? Is it indeed the patients that define the value? And is that also clear that value, what will it bring? Is there the urgency also from patients to move in that way? Do they feel that this will really help them in achieving better outcomes on their level? Is that the sense of urgency that you feel with the patients?
Yes, definitely. So, value-based healthcare has the potential to transform the healthcare system by ensuring that care is centered on patients and what truly matters to them, as I mentioned before. And some examples of benefits that a sustainable value-based healthcare could bring to patients include ensuring that care is designing to meet the specific needs of the patients rather than focusing solely on the volume of services provided. And this was mentioned, this I mentioned also before. And this shift ensures that the treatment plans are tailored to individual needs, preferences, and values, offering a more holistic approach to care. Then the focus is shifted from simple process metrics, so number of treatments administered, for instance, to the actual health outcomes for the patients. And also value-based healthcare brings a more comprehensive approach where patients receive a continuous care and support also after the treatment.
But I think in summary, what I see here now, I think we all see the importance and the urgency to move value-based healthcare. I think it's confirmed by all groups. But then indeed, I think we, going also back to the report, maybe Hamish also looking at you as a first speaker, like, why is that compass for collaboration so important? Because I think we kind of all agree that it's important to move to value-based healthcare. But what is the report adding? So what's the relevance, in your opinion, of the report that the Alliance brought?
Thank you. Well, may I just say, as a clinician, could I just say one thing about the patient as well?
Yeah, of course. Yeah, that's what a doctor does. So.
Yeah, exactly. So I mean, value-based healthcare is a technical change, but it's a cultural change, more importantly, and it's a cultural change for healthcare providers, clinicians, as much as it is for patients. And you know, I was a medical director for many years, and I used to listen in the board how we were always saying that the patient was at the heart of everything we did, and I knew that wasn't true. And value-based healthcare really does put the patient at the heart of whatever we do. And it is if you have outcomes and you have meaningful outcomes, then you can have proper shared decision making. And so when I was consulting with patients, you know, I would try and share what I thought the outcomes were, but I was only measuring the outcomes that mattered to me, not the outcomes that mattered to the patient. And so it's really so empowering to be able to do that and have the evidence. And then finally, a lot of the low value activities places a burden, a financial burden on patients. You know, just having an appointment in the hospital that adds no value. They've got to get there. They've got to take time off work. They've got to pay for travel. So, you know, we mustn't lose sight of all of those other things. The answer about the compass is that I think it really demonstrates, and Thomas alluded to this, is that healthcare is an ecosystem of many different actors. And unless you have all of the ecosystem aligned in the same direction, it is very hard to make the system value-based. So you need, you know, you need the delivery of care to be value-based, but you need the procurement. You need value-based procurement. You need value-based research. You need value-based HTA. You need all of that. And then, of course, as Alexis says, you know, you need hospital managers to be aligned with this as well, and the people who own and run hospital and payers. So the compass really emphasizes that point, is that it's everybody's business to make the system value-based, to get better outcomes for patients within the resources we have. And I think that comes through so clearly from this report. So that's what I think is so valuable about it.
Thanks, Hamish. And I think that's also quite aligned with what Martin said, also on the point of reducing low-value care. It's like it's everybody's business, but it helps if you clarify and make that more obvious. Otherwise, people start probably looking at each other and waiting. Alexis, and from the EHMA side, any other or additional points to why that report is so important?
I think it goes back to what Hamish just said about a cultural change and making sure that the ecosystem is aligned. So I see this report as the very first step for everyone to be aligned in terms of what value-based healthcare is and what it means. But then it's up to the different organizations that are part of EAVH to then take that and implement it, put it into practice, and explain to our stakeholders, so in my case, EHMA's members, what this means for health managers and how concretely we can put this into practice.
Very good. Yeah, and that nicely links to for me at least, to a follow-up question I would have is indeed, like, because what the report does, it makes quite specific for each stakeholder what the role can be, and there's quite a bit of elements in there. But maybe also starting with you, Thomas, is what is the main thing you feel, at least the industry or the pharma industry, maybe more specifically in your case, they can do now to start the movement in line with their scope of responsibilities? What can they do to start driving this?
Well, I think that first of all, the industry can continue and being even better at involving patients in all stages, starting with early R&D to understand what's the unmet need, what are the outcomes that patients are looking for. And here, I think, you will see a varied picture across the industry. Some companies doing that very well. Others need to strengthen that further, but not to take the eye off that particular ball, I think is very important. Then I think it's also about trying to find these partnerships that are a bit more long term. And of course, it's easy from a private company perspective to focus on the next quarter and the sales we're making right now. And some of the business practices in companies are geared towards that goal. But I think you need to take a more longer term view of what's our role here and how do we create a partnership that looks at the outcomes in a long-term perspective. Because indeed, and I think Antonella talked about this, that value-based healthcare is not about producing a particular number of procedures or interventions, but it's about deliver outcomes. So how can the industry be a partner in delivering those outcomes for people, populations, and patients that we want to achieve? So again, it's a bit of this mindset that Hamish talked about. It's also about the culture, not only about what to deliver. And then of course it's particularly around new therapies, being ready to offer different kinds of outcomes or value-based agreements when that is needed to sort of link payments and reimbursements to the actual outcomes achieved in real life. And I think that will be also facilitated by having a value-based system, because in the end, to make value-based healthcare work, we need to be better at collecting these outcomes data from routine care. So you see what actually works in clinical practice. And that will also make these kind of agreements easier and thereby facilitate access to innovation across the system.
Very good point, Thomas. And I think what I specifically also think is important that you only ended with the outcomes-based agreements and not started with it, because I think a lot of times people feel the role of the industry is only outcomes-based agreements, but I think there's way more they can do. And although I know, Hamish, and maybe we'll come to that later, but I know you use the terminology value-based supply on the side of the industry, but I think also what Thomas said is important that the industry does not act as a supplier only, but I think this, if you want to collaborate, it's being a partner in the health system and not just a supplier. I think that's a point that Thomas said that came across quite well. And maybe Antonella on the side, I hope the connection is back again, looks like it. On the side of patients, I think it was clear that there are benefits, there's urgency, but is there also a role that what can patient and patient organizations do from their side to drive this forward across countries in Europe?
Yeah, so I'm back. So definitely we need to support training and education in the patient community. I think that this is the biggest priority for us when it comes to the implementation, the effective implementation of value-based healthcare, as we need to empower patients with knowledge, as this is key to ensuring that they can navigate the healthcare system effectively. And also patient organization can support training and education efforts, helping patients build their health literacy, digital literacy, and understanding how they make informed decisions about their care. And this would ultimately lead to a more informed patient population that can engage meaningfully with the healthcare providers. We also can play other roles such as assess holistic patient needs and identify service gaps, because there is a need to map what is available out there, what are the good practices already there, and this will, this mapping would help us advocate for the right services in the right places. Then also we need to advocate with the policymakers. Sometimes I feel like as a patient group, we have a more direct, open line of communication with policymakers. So if we have the right tools, the right arguments, we can really help developing an ecosystem that is able to support the implementation of value-based healthcare. And again, we need to raise awareness among different groups, including essentially patients, on the importance and relevance that value-based healthcare can have for them, including helping patients understand more and more the value of sharing health data. And also the shared decision making is an essential tool that would help an effective implementation of value-based care. And we as a patient community need to empower patients so to be effectively part of this shared decision making.
And I think if I hear you correct, there's really a lot indeed that patients can do, but I think you said it, but for me it feels critical that patients are aware that they can play a role or have to play a role, because is that where it starts in your opinion? Because otherwise I'm not sure they will raise their voice and they will step up.
So definitely raising awareness is the first the first step, but then once they know that value-based healthcare is important for them, they need to have the right tools in order to be able to support a value-based healthcare implementation, and that is education, training. But then on the other side, we also have I could say the duty on one side, but also the power on the other to advocate with policymakers.
Yeah. Okay. Clear. Thanks a lot. It's No, I think it's like for me, I feel it's reaching the patients to make them aware of the rules again is the most critical starting point. I like it. Yeah. And Alexis, I think you didn't move away or embrace the topic of taking responsibility, and I think you agree to that. So if you look at health managers, like what are the key things they can do in driving value-based healthcare? If you want to be quite specific there, also as a call to action, hopefully to some people attending the webinar today from your audience.
Yes, absolutely, Casper. So there are probably too many actions. I could take all day going over those. There's many, I should say, not too many, but there are many actions that health managers can take. But I think if the three that come to my mind as the ones that are super critical to put in place now would be strengthening digital infrastructure, building a culture of continuous learning and improvement, and implementing outcome-based performance measurement. So, looking at digitalization, it's very timely because we know actually today, I think the European Health Data Space Regulation goes into effect. And with that, the electronic health records. So this is an opportunity for healthcare managers to have interoperable data systems that allow seamless sharing of patient outcomes and treatment data. And then in terms of continuous learning and improvement, this is really one of my core topics that I love to talk about, but healthcare managers can provide training and professional development for healthcare professionals. So patients, of course, they also need training on value-based healthcare, but on the flip side of the coin, so do healthcare professionals. So there's an opportunity to build in the value-based healthcare principles into these training and professional development opportunities. And then lastly, on outcome-based performance measurement, I think other speakers have already touched on this, but healthcare managers specifically can develop standardized frameworks to measure patient-relevant outcomes. So it talks about this in the compass for collaboration, right? The PROMs and PRIMs. So this is really where healthcare managers can bring their expertise to put this into place.
Thanks a lot, Alexis. And maybe we, just before I go to you, Hamish, there's one question in the chat maybe that's relevant, Alexis, as an extension to this one, is where it says, what do senior health leaders need to do differently from a governance perspective to facilitate value-based healthcare in their organization? And probably this is more, I see this a little bit, health leaders in this case can be very broad, but maybe indeed health managers. Is there a specific governance element you feel that that's relevant to address?
Yes, I mean, I think healthcare managers are uniquely positioned to drive value-based healthcare because these senior leaders, especially, they have oversight on operational processes, resource allocation, organizational culture, that change management aspect that is so essential for implementing this approach effectively. So absolutely, they're the champion. If they can be the champions for this, and for the change management, the communication aspects to say, and really the vision in the organization to say, we want to put in place these changes, outcome measurements, collaboration, and this is why, then the implementation will be go much more smoothly, I think. So yes, absolutely, a big role to play.
Thanks. And Hamish, when we started off, the question indeed was about what are key actions can a stakeholder group that you represent do, but then the challenge comes, Hamish, which stakeholder group do you want to represent in answering this question?
Well, I think we've established that there's a role for every stakeholder group. But if I just talk about the enablers, which is kind of why I'm here, I guess, there is clearly a massive knowledge gap, an educational need for this, and we've already touched on this. It ranges from patients right through to chief executives and policymakers. So the role of academia is to be there to provide high quality, effective education that's accessible to the people who need it, targeted at those individual groups. And there is really good education going on, not just ours, other people's too, but there isn't enough of it yet. So we have to do more. We have to do more, I think, to do that. And we still need also to be doing the research, because there's a lot of research around implementation science in general, but there is specific learning about how do you make some of these changes that we need to do, both the technical changes and the cultural changes, to really see effective implementation of value-based healthcare and value-based procurement and all the other elements of it. And I would just to echo one thing that Antonella said, possibly strengthen it. I think we need patients to be demanding it, not just knowledgeable about it. I think they need to, I can say this as a surgeon, I would have wanted my patients to be saying, yeah, fine, you've told me what you think is important, but can I ask you about some other things that are important to me? Will I be able to get back to riding my bicycle? Will I be able to play with my grandchildren? And I think there are many more patients than there are clinicians. So let's get an army of patients really expecting that they are involved in shared decision making, and that shared decision making is informed by good information about outcomes that matter to patients.
I couldn't agree more. It's like, and I think indeed I can also imagine as a doctor sometimes, especially if you're not educated in the way, and that's also where education is again very important. So in the meantime, before we all get educated on the importance of shared decision making as part of value-based healthcare, it is a demand that you must probably need to put on the table in a nice way, so to get to a collaborative discussion. Sorry, go.
I could say, and if I could say one thing to Alexis, I think, and I agree with everything you've said, Alexis, but I think the real test of whether your system has become value-based is when an operational manager comes in on a Monday morning, they turn on their laptop, and the first thing they do is say, what were the outcomes that the service that I help support, say orthopedics or whatever it might be, what were the outcomes last week? Not, did we hit our target for performance? What's the budget? Do we have enough nurses for Ward 6? Those are all important things. But the cultural change will be when all operational managers see themselves as an integral part of delivering great outcomes.
Yeah, maybe, I see your comment. First, go and comment on it, Alexis. I see you're going off mute, so you want to say something.
No worries, Casper. I was just going to agree with Hamish and say, very well said. Couldn't agree more. Thank you for that.
Hamish, is that maybe also a bit, I saw there's another question in Q&A, and I noticed that you were typing an answer. I don't know if it was deliberate, but the question is there a move towards aligned metrics to drive the right behaviors to address this? Is the move to value-based healthcare? It was the first question coming up, what I already mentioned. It feels like we've been talking about value-based healthcare for years, yet progress is slow. Do you feel those metrics, like you almost just described them, is that critical that we look at different metrics?
I think, yeah, I think so. I think it is slow, but it's a big change. It's a huge change, and it is frustratingly slow. As I say, in Wales, we've been at this for a while now, and it's finally we're kind of getting a sense that we're getting to a tipping point where it's becoming how people think, and that's a critical part. If you see it as something extra, it will, like clinical audit and all those other things, then it won't happen. It has to be the way you think about how you do stuff. I think, the metrics have got to be about, well, you've got to measure outcomes. Let's remember that when, Michael Porter started all this, he discovered that nobody measured any outcomes, which is where I jumped from. So we have to measure outcomes, and we have to measure outcomes that are holistic, that matter to patients. And then we have to demonstrate that they're getting better. But you can't do that unless you measure them. So I think there is pretty clear, there's reasonably consensus on, what are the outcomes you should measure and when you should measure them. The work of iJump's been very valuable in that, but other people too. And then the truth is, you should see both population health and individual patients' health improving within the resources we have. And at the moment, there is some evidence that they're getting worse. So I think that's it. And from the supply side, or the industry side, as you rightly say, we've done quite a lot of thinking about that. And there are some clear things that industry need to be doing to play their part and be ready to prosper in a value-based ecosystem.
Thanks for that one, Hamish. And I was just also looking at a recent question coming in. It's a little bit linked to the point that we said. It's about the metrics and measuring the outcomes that you said, Hamish. But the question is how big is the motivation of healthcare providers to move to outcomes measurement? I hear quite a big fear from even more bureaucracy in hospitals in Switzerland. And Alexis, I know you represent healthcare managers, but is this something you could address? Do you also feel that the healthcare managers see an admin burden coming to them because it's additional registries or things we need to register? Is that a sentiment you hear as well?
Well, I would say that this is likely the sentiment that you would hear from a lot of healthcare managers, because change is always difficult, and it's not easy to rethink and re-strategize on your systems. But I think the best way to convince leadership that this is something worth investing in and worth doing is by giving them concrete examples of when it's worked and ways that it works. There's no one size fits all, of course, we know this, but we do have examples from across Europe that we can point to say, maybe you could look at this, maybe you could look at that. See how they've done value-based procurement, see how this hospital has done task shifting, see how this hospital has implemented structured triage systems. Because once they see that there's examples that actually improve their working conditions, they're going to be more motivated to say, okay, so the outcomes for patients are better. It's more efficient for us. We're saving money. So yeah, okay, now I'm convinced. And that's really, I think, how the approach that's needed. So it goes to what Hamish says, we need research. That's of critical importance, because with that evidence, we can go to these senior leaders and advocate. And then of course, we need evidence for other reasons too, as policymakers and for advocacy purposes. But that's one of the uses of this research for sure.
Yeah, and there it also then really comes down to really clearly demonstrating the benefits for every stakeholder in place. So if you see the benefits where it's helping you as well, then it's also worth investing your time or to register. Yeah. So,
exactly.
Also, in minus time, there are a few questions that Alexander, do you want to say something? I see.
Yes, I want to say something. I mean, I really appreciate this discussion because it shows how complex are these efforts aimed to delivering value-based healthcare. And I think my colleague Martin has already mentioned during his presentation that part of our regular calls, we also are funding a very large partnership on transforming healthcare systems. And it was here that I wanted to come. So among the various tools that this partnership is using, I want to mention a knowledge hub where we aim to put all the information that would be relevant for this value-based care. But a part of this, the partnership has started to look for and to select, to promote certain ecosystems that are considered to be successful in delivering this sort of value-based healthcare. And there are a couple of things that we have noticed. So first of all, these successful ecosystems rely on what has already been mentioned. So first of all is the involvement of patients so that they feel that their interests are duly taken into account. Secondly, that there is a very good alignment of stakeholders. So there are many stakeholders involved here and they all work together. So it's about hospitals, administrations, research institutes, insurers, patient organizations, and so on. And another thing that has been mentioned is that all this ecosystem rely on a sort of mycelium, a sort of network, underground network that is based also on voluntary work by people. And the comments that have been made by the researchers that are involved in this identification of successful ecosystems is that, first of all, those ecosystems are generally small. So they have, for the time being, they have managed to identify somewhere above 20 such ecosystems across the European Union. They vary around 100,000 to 1 million people in those respective areas. And as I said, the voluntary part and the involvement, the enthusiasm of the community contributes a lot. And here I wanted to make a reference to what has been mentioned about the measuring the outcomes. Of course, that some key performance indications has to be considered. But when you try to burden too much the system with too many indicators, then it becomes a bit cumbersome for those people that act out of their free will, you know. So you kind of hamper you affect this aspect of voluntary work. And this is a problem because we need to find the right balance. So as I said, such ecosystems are very successful at small scale, but when large administration like country-wide administration want to take up and to scale up such ecosystems in order to control better, because there is a different responsibility of at the level of a large country, they try to add more measurement of the outcomes, such KPIs. And here there are problems in, let's say, ensuring the continuity of this enthusiasm in the local population. So that was my message, that all these aspects are important, but we need to keep a very fine balance between the different needs, requirements, and so on. Thank you.
Oh, thanks, Alexander, for coming in on this one. So you're formally not a part of the panel, but it's great to have you here because I think that's a great comment. And What I reflect on, it's quickly on this one, is what you say. It's a lot of things indeed are, and maybe that's true at the moment, it's voluntarily, it's people who really feel the need to drive so, but I think that also, for me, that means the other way around, that we also need policies and incentives that stimulate it so that it becomes more than just voluntary and underground work. It should be rewarded in a proper way, for at least that's how I see it, to make it more standard. And it's great that you see that a lot of being done on the European level. But I think also one of the questions, and I don't know, Antonella, maybe you want to comment on that first. I will see. The question is rightfully: is there something we can do at the European level? Is value-based healthcare something that the European Commission drives, or is it actually more a country by country and a more national thing? How do you see that, Antonella? Yeah, before Alexander is here, I just want to hear Antonella's perspective as well.
Well, from my point, I believe that we need to work on both levels, and also on the voluntary perspective, like voluntary groups, voluntarily setting it up is fine, is perfect. This is a sign to me that we are ready to make to walk this step further. So now the system, in a way, is ready to move on. But as you said, Casper, we need the policy, we need the guidelines, so we need the regulations in place, and so to that we need those regulations, those guidance from the European level, because from the European level, from my perspective as a patient, from the European level, we need to avoid inequalities, so that we have clear indications that are equal for all, and so all member states should follow the same framework, the same, I could say, template. Of course, this is very difficult, possibly impossible to implement, but we need to provide the right guidance, the right even indicators. I understand that a framework that is too much the prescriptive can be can slow down even more the process, but on the other side we need this framework in order to have an homogeneous and equal ecosystem across Europe. But then health happens at the member states level, or sometimes at the regional level, so then we also need to work into the implementation at the local or national level.
Yeah, and I fully agree. I think it's on both levels where it happens on the ground in the countries, but I think on the European level we can facilitate and drive it forward and support that move, I think, if I would summarize it. I know we're only a few minutes left, and I know Hans wants to conclude as well. So maybe just as a final round, quickly going one by one to just hear your key takeaways from today's discussion. And of course, you can come up with the points that you already felt, but if there's anything new that you learned or heard today, that would be great. And maybe Thomas, do you want to start? Like your take-home message also for the industry itself?
Yeah, I think this has been a great discussion, and I think there is a lot of alignment, but as we all know, this is complex systems. And I think to come back to this last point, that I think obviously value-based healthcare will be implemented at sort of national level or even regional level. So you need the political buy-in, I think, to make this a system issue and not just individual pilots. You need the payers on board. In the end, health systems, people will follow the money, also in public tax-funded.
That's how it works.
You need the budgets to be aligned with this. But I think that and it's great to have the European Commission on board here in this discussion, because I think that there is a clear role for the European dimension here. And I think it is about the data. It is about what should we measure. And I think some great things are already happening. And the Commission is, co-funding together with FBI this project to set up health observatories called H2O, that is part of the Innovative Medicines initiative that through patients fit in their outcomes data to these national health observatories in some therapy areas. And there's also an umbrella organization sort of at European level that can connect this. So I think this shows that, and then we can have comparable data across countries. And I think there's a huge power in that. And coming back to the issues on Europe's competitiveness that we also started off with, this is also a huge opportunity for Europe that we should take.
Thanks a lot, Tom. Some very good points. And indeed, happy that we're all on C. It's both levels. It's national, but there's absolutely things to do, be done on European level. Alexis, some closing thoughts from your side, maybe?
Absolutely. Yeah. So for me as well, what MEP Oriate talked about, and also Mr. Costestu, was about Europe's competitiveness, and then Thomas talking about political buy-in. This is what really resonated with me because, I think in this geopolitical landscape, which is on all of our minds, I think keeping health high on the priority list is this is an opportunity for us, because if we face any kind of crisis and our health system is not resilient, we're not going to be able to withstand the shocks to the system. And so this is an opportunity now, and I would say a necessity really, to implement value-based healthcare.
I would say indeed more necessity than opportunity in light of the geopolitics, indeed, yeah.
Very much, yeah. So, and this requires commitment, the political buy-in, absolutely, but commitment from all stakeholders, because the potential benefits for patient care and system resilience are profound. Yeah.
Perfect. Thanks. Hamish, some famous closing words from your side before we move to Antonella?
Yep.
I know Antonella needs to take a plane, so we need to finish in time.
Okay. So I as others have said, the time for talking is gone. Value-based healthcare is essential now if we are going to have sustainable health systems that deliver better and better outcomes for patients with tight resources, both human and financial. And the great thing is that it's a kind of unifying concept. It brings benefits to all stakeholders. Value-based healthcare, it's great for everybody. And if we all come together, we will get this implemented faster. So it needs all stakeholders aligned, and then we will see faster progress.
Excellent. And progress instead of discussions and talking.
Indeed.
Fully agree. Antonella.
Yeah, just to conclude, so we all agree that it is essential. We all agree that it is beneficial to all. So I think that we really need to enhance more and more the sense of urgency in implementing value-based healthcare. So the sense of urgency needs to be pushed. And I conclude here.
That's very good.
Thank you.
Thank you. Hans, you're still there. I know you need to leave quickly as well, but do you want to quickly close it off? And then we're almost in time still.
Sure, Casper, and thank you for moderating the panel. I'm well aware of time, but as we come to an end of today's webinar, I really want to thank all of the speakers and the panelists for the time and insights. A big thank you to all of you joining this webinar today. Now, if today's conversations, and I hope, have sparked ideas, questions, doubts, interest, we encourage you to reach out to us, because your input or your organization might be the missing piece to the puzzle we're trying to lay down. So you can find our contact information on the website, European Alliance for Value in Health.eu, but also directly through the email contact on screen, info@valueinhealth. And thank you so much for joining today. Take care and goodbye for now.